Welcome to the Seraphine podcast on my YouTube channel. I am Seraphine Arocha, and today we are with Dr. Spencer Eagan. Hello.
Hi, how are you doing?
I am doing great. This is hilarious because this is like first meeting, but not really between us, where I get to kind of dive in and get to know you with no pressure, just being recorded with, cameras on you.
Not at all.
I love it. But we're going to go into a little of your background and then also your relationship with a wonderful person who we're both friends with, Kara Gutierrez. But before we get into that, let's give a little background of Dr. Spencer Eagan, who is a board-certified plastic surgeon right here in Kansas City. You're a graduate of KU Med and a co-founder at St. Luke's Plastic Surgery Specialists. I mean, that's impressive. After a 6-year plastic surgery residency, and I think it was at the University of Missouri, right? Medical Center.
Yes.
All right.
Yes. Spent 6 years. It was a little tough transition going from lifelong Jayhawk to going to Columbia, Missouri. But, we packed up and went, and we really never looked back. It's a great city. And, but all in all, we were looking forward to getting back to Kansas City. We love this town. We love the city. And we were counting down the days to be back here.
I mean, to go into medicine, was it a part of your family, or were you the first doctor in the family?
I was really the first one in any realm of medicine. I have an aunt who was a nurse, but I was the first one to go into, be a physician.
All right.
Early on, I wanted to be a veterinarian.
Oh, wow.
And my dad's brother was a veterinarian, and went out to Coeur d'Alene, Idaho, and visited him and his practice. And he was more out there to mountain bike than to really do the veterinary stuff. And so it kind of turned me away. And then I knew I kind of wanted to go down the pathway of medicine. And
that's so cool. And then what was the choice of plastic surgery? Like what drove that?
Yeah, so I tend to be fairly calculated with what I do, and so what I did is one of our family friends was an anesthesiologist, and so I shadowed him over the course of several times, going to the hospital with him to kind of see the various subspecialties. And early on, I thought I liked orthopedic surgery, and what I found out, it just seemed like they were doing a lot of the same thing kind of over and over again. I was seeing a lot of joint surgeries and things like that. And there's definitely, within the realm of orthopedics where they're not, such as trauma and things like that. But the case that really got me was when it was mainly an orthopedic day, and they took me to a room where the plastic surgeon was doing a free bone graft to repair a bone defect. And in my mind, I was like, why is a plastic surgeon transferring bone and tendon and all these scenarios that I was like, that doesn't make sense. That's ortho. And so, that kind of opened my eyes to what is plastic surgery. And really what I've loved about it is every day is different. So, there are days where I may be just working on the face, or days where I'll be working on the breast or the body, or doing all cosmetic one day, or doing intricate hand, another day. And so that's what I love about it. No day is the same. You have to be able to think outside the box. Even if you're doing, the same case 10 times, it's rare that you're doing the exact same thing. Everything is really tailored to the patient, the anatomy, the history, the goals. And so that's really what got me into it, is the ability to kind of think and be creative, and not that there isn't that opportunity within the other fields, but I just love the breadth of what is plastic surgery.
I'm fascinated by it myself. I'm a big fan of it. Being 44, I think I'll probably have more of it. But at the end of the day, I was so excited to have you on for personal reasons, because I'm curious about certain things, but also because I've seen people who have been through horrific, life-changing accidents and watched them feel like themselves, or they've had a health experience that has taken something away from them, and plastic surgery has allowed them to feel more like maybe not themselves. I like to say we're evolving forward, and even when something bad happens, you know, you never go back. You move forward, right? So I guess let's talk first about kind of your clinical focuses that you have. So you obviously breast augmentation. I would think that that would be one of the main, like you're doing this all the time. Is this something that you do a lot of here?
Breast surgery in general.
Yeah.
I do very high volume breast surgery, and so essentially I do the whole complement, all the way from breast cancer and breast reconstruction, to augmentation, to reduction, to lifts, to fat grafting to the breast. And so really with my time at St. Luke's, we really built that practice around breast reconstruction, and those are some of the hardest scenarios. And so that is still my passion, is breast cancer and breast reconstruction. And so really building my skills in that has made me better at even the aesthetic and the cosmetic surgeries that go with it. And at this point, I love the whole scope of it, and I do head to toe, cosmetic and reconstructive surgery. I've got a good mix now, about 50-50
cool.
at this point, and so I do very high volume breast surgery. I also do a lot of body contouring, and from my time at St. Luke's, I was doing complex hand and
I was
things
so
like
fascinated
that.
about this. So talk to me a little bit about this. I don't know much about what that entails. So who would come to see you? What are they having done? Because again, I think plastic surgery, hands.
Yeah.
So
it definitely is a big kind of misconception. So it's definitely not thinking of plastics as all, breast aug and tummy tuck and lipo. And granted, there are days and weeks that is my main focus with the aesthetics. But when I was at St. Luke's, so really the complex trauma that came into the city, we really rarely turned anything down. So, KU and some research, some of the other facilities, I'm sure we're missing some that do some of the complex hand, but we really took a lot of pride in handling what walked through the door. And so the intricacy of hand anatomy is what makes it fun.
Yeah.
And so just trying to be able to put Humpty Dumpty back together, being that each finger has bone, nerves, tendons, and not only is it about the way it looks, it's really more about function. And so unlike what you're thinking about with aesthetic plastic surgery is how is it going to look, what are their goals, things like that. With hand surgery, it's about function. So it's not just about putting point A to point B. It's you have to do it in a manner where it's going to move, where it's going to work, where it's going to regain sensation. And so the intricacies of that is what I enjoyed, and had a great group of guys that I worked with, and great team, guys and gals that were part of our team. And but at this point, it's not as much of my focus because I'm not taking the traumatic call anymore. So at this point, I still do quite a bit of elective hand, do peripheral nerve, and lumps, bumps, carpal tunnels, trigger fingers, Dupuytren's disease, those type of things. All of which may be like, what is that? But
I know, right? I was actually that was so funny. That's actually in my notes. I was like, what is Dupuytren's? What is that? What is it?
So the easiest way to think about it is just kind of like tightening down of the fascial or the dense layer of the palm. And so what happens over the course of time, it can kind of pull the fingers down. And so it's a matter of, how do you get that hand back to function? How do you get that finger so it's not in the way? And, it's come a long way from where it was in training. It used to be something that we operated on almost all of it. And there's injectables to break up the cords now, and we're very lucky to work with some spectacular hand therapists, and especially as it comes with anything with hand, it's all function. So it's getting them back to activity, get them back to moving, and so it really is a partnership with the hand therapist to get everything moving again.
Okay. So I'm curious, where are you at now from St. Luke's to now? You're with Ascentist, correct?
Yeah, so it was something that I've always embraced the business side, and it's something that I enjoyed. I took a very active role even at St. Luke's, and so it was a unique opportunity to go private and really kind of build what I felt like is the reflection of what I want to see with my practice. So I joined Ascentist, and we branched off within Ascentist to form Ascentist Plastic Surgery. I'm partnered with Dr. Jeff Markey, who is an ENT-based facial aesthetics doc. So, we collaborate very well. He does a lot of rhinoplasty and facial cosmetics, and I do essentially head to toe. But he's just been a great guy to work with. Really the base of why I joined the practice was Dr. Doug Cowan, and so. It was an ENT based practice. When he took over, kind of helping run it with really a great group of docs that they had already had, but he's just a very motivated, business savvy guy, and so we really work hand in hand, with our business initiatives, and we have close to 35, 40 providers at this point. The predominance is ENT, but we have plastics, we have pulmonology for sleep medicine. We've got a GI/general surgeon starting next month. We have audiology, allergy, immunology, orthopedics, and so it's really been a lot of fun. And as it relates to Ascentist Plastic Surgery, a lot has been how do we create the space that is reflective of the experience that we want. We had a unique opportunity to partner with Tamara Day, who's a HGTV host, and she's just spectacular person. So we had a lot of fun working with her. She kind of helped to kind of utilize the vision that we had, or thinking about kind of like the geode concept and transformation, but to create a welcoming environment. And I feel like she did a great job, and she's brilliant in that right from a creativity standpoint. So we've got a really nice space out of Metcalf. We've got 13 locations. With Ascentist in general, we have 3 locations with Ascentist Plastic Surgery. We have one in Leawood, one in Overland Park at 143rd in Metcalf, and then do some time at our Miriam location, which is one of the surgery centers that we're partnered with. So
now I'm curious, and again, it's also helping our listeners understand the difference between more privatized medicine versus where you were at before. To kind of explain it, I'm going to have you throw it. I'm going to throw that to you.
Yeah. So really my focus is a lot more in the aesthetic realm. I still do a lot of breast reconstruction, but from my day to day, whereas before I was on call for 9 years, I'm not really taking any primary call per se. I still give my patients my cell phone and things like that. I want access to not be an issue as much as we can, and but my day to day is a lot more aesthetics. I'm partnered with Rajanir Medical Spas, their medical director. They've got 4 locations all over the city. So if you look at top to bottom, what we're able to offer at this point, we're able to offer really a comprehensive aesthetic package. Whether it's the minimally invasive things such as the peels or the needling, all the way to the more involved things such as the tummy tucks or the liposuction, the breast augs that I do. And so and it's like anything else, you're constantly evolving. You're constantly seeing, all right, what is next, where do we want to be. And that's what's been a lot of fun, is being able to make changes in real time, and build and grow. And, and a big part of it is my staff too. And I was really lucky that, to continue to work with the staff that I had for 9 years. My nurse is really my first nurse. My PA
that's cool. Yeah.
Was my nurse right before her, and then she left. And so a big part of what we try to focus on is the experience, the education component, and then obviously the outcomes. You have to do a good job, but it's got to be an experience. And so And we really want it to be an experience from the second they walk in the door. We want to create a welcoming environment. I tell my staff, let's kill people with kindness, and that is really the focus of our practice.
What has been, if you were going to say, one of your most challenging procedures that you were like, you walked out after you were done, you're like, wow, that was using every bit of knowledge in my head, every skill you have.
Yeah, so some of the mutilated hands, especially as it relates to call. I've seen some pretty horrific facial injuries, pretty horrific hand injuries, and so there's definitely some that you're looking at being, where does that go? And so sometimes you're having to steal parts from one place to move it to another, and steel bone, steel nerve, steel tendon, or just put it back together the best you can. Same thing with the face. Even in training, we had some pretty horrific facial injuries. Essentially having to rebuild the face. So those ones when you walk in, you're scratching your head, looking at, all right, what is that?
Yeah.
And then you have to, take it back to form and function. Those are probably the most challenging cases that I've seen.
So for people listening, I like to ask a lot of the people in the chair about how they would describe how they are in their line of work. So I don't mean to be cheeky and be like, how's your bedside manner? But how would you describe your bedside manner with what you do? And what do you think is key and you think most plastic surgeons should have in their bedside manner when someone is going through a procedure?
Yeah, and it's a great question, and it's hard within the realm of medicine these days too, because you're seeing a lot of patients, and if you're doing the insurance-based stuff, you have to see more than you did in the past. But really, what I try to do is I try my best to listen. Like, the things I focus on is like, what are your goals, and so that's usually one of the early things that I try to get from the patient. And so a lot of the early discussion is asking questions, because even, for an example, someone comes in with the interest in a breast augmentation, first several minutes are me trying to dial in, like, what is their vision of where they want to be. And so I work really hard to try and listen and try to have a plan that reflects what their goal is. But the next focus then, I feel like knowledge is power, and so we really try to focus on education. And so the statement that I make with a lot of my patients is that in the operating room, I can do my part, but a big part of your end outcome is following through on the restrictions and following through on the guidelines for surgery, the scar care, the compression, all those things. And so what we really try to create is a partnership. And I try to think of myself as a normal guy, and I don't ever want to stray from that. And I would hope that that's the way that patients feel. I have patients that come and hug me in tears, and and I really try to connect as much as we can.
Oh, what do you feel like future holds for yourself? What do you hope for, I guess, for your just the coming years in your career? I mean, you're established. You definitely are a part of something that's amazing with Ascentist. But what do you see for yourself?
Yeah, so for me personally, I think just continuing to build and grow, and my goal is that as we continue to do it, to make sure that we maintain the level of communication and experience, and just continue to create that environment that patients like. And I think over the course of my career, I've migrated more towards the breast and body, and so I see down the road probably a little bit more of that as a focus. But I still do complicated facial aesthetics, and I enjoy it. I enjoy it also. So it's hard to say, just because you you never know where you're going to end up. And I truly enjoy it. From a practice in general, though, we're really looking at doing big things. And so it's hard to say where we'll be in 3 years, because even after the past 9 months, we're so different in terms of the specialties that we've brought on. And really the goal of what we're trying to facilitate is create an environment that the physicians, the APPs, the advanced practice providers, and the staff are happy. And so it really is more of like a cordial environment than I've ever. And it's not a knock on anything before, but
Of course.
we have a huge group that the whole group will get together on a regular basis and talk and bounce stuff off of. And so we feel like if we're supporting the doc or the providers, and it's amazing what happens when you give them what they need for success. It really creates motivation, efficiency, and happiness in general. And so I think if we stick with that plan, we're going to do big things here in Kansas City in terms of what we can achieve to kind of change the framework of what we consider just general medicine. So,
Well, I have really enjoyed sitting down with you like this. It's exciting to see someone who is on the precipice of something. I mean, it's already established as Ascentist is so mind-blowing of what they're doing, but it's so cool to see that we're going to be seeing more growth. And then I also love the fact that intertwined, we're going to go more into this with Kara. She's going to sit down with us as a part 2 of this interview. But your outreach, especially within this month that is Breast Cancer Awareness Month, where we'll definitely further the conversation and have Kara pop on the mic here. But thank you so much for sitting down with me today.
Yeah, thank you for having me. Kara had mentioned this as an opportunity. I was like, heck yes, I would love to. And I'll echo it again. I said it off air before, but you've made me feel very welcome, and I am not someone that loves being in the spotlight. I know there is a billboard up there for our hair transplant program, but I don't love doing that. In general, we really try to grow with patient experience and outcomes and things like that, and so it's definitely a little outside of my comfort zone. So I want to thank you for the opportunity and making me feel so comfortable today.
Thank you. Well, if anyone would want to learn a little bit more about you, or actually come see you, how do they find you? What is the best way?
Yeah, so if they go to AscentistPlasticSurgery.com, that is our website. We have a new program that we rolled out fairly recently, robotic hair transplantation. So, there's a billboard on the highway for that. So, Casey Hair Transplant is the website for that, and so. Really, that's probably the best way is to go through our website, and like anything else, we're working on even making that more efficient. We're working on QR codes that we can give out to provide primary care providers. That's to exciting. Just create an easy way to get people in. But the AscentistPlasticSurgery.com is the best way to get directed to us, and we'd love to see the folks that listen.
Definitely. Well, thank you again, Dr. Eagan. This has been, it's been my pleasure to have you in the red chair on the Seraphiend podcast. For those of you who are listening, if you enjoyed this episode, please hit the subscribe button below. And if you have any questions, please give them to me, and I will pass them off to Dr. Eagan, because let me tell you, off camera, I'm going to be picking his brain about some procedures that this old dog who needs to be taught some new tricks in her body at 44, I'm going to be asking him. Thank you so much. See you guys later. Bye-bye.
Thank you.